I am Dr. Nardo. I am an editor fellow of the JIPO, the Journal of Immunotherapy and Precision Oncology. And today I have the presence of Dr. Kurzrock. She's an associate director in clinical research in precision oncology of the Medical College of Wisconsin. And she's an international leader in precision medicine and therapeutics in oncology. So thank you for being here, Dr. Kurzrock.
My pleasure.
So today we have the idea of discussing a publication that you've done in the JIPO, and the name of the publication is Of Mice, Not Men, When the Bench-to-Bedside Bridge is Broken. So my first question about it would be if you could start giving us a brief introduction about this topic to our audience.
So thank you for asking. So we thought that this was a really important topic, especially in the field of cancer, for clinical trials with cancer. So what we know is there are a lot of drugs and a lot of methodologies that are really successful in mouse studies. And of course, sometimes they're successful in humans as well. But many times we get really excited about mouse studies. And then when we bring the agent into the clinic, it doesn't work very well. And at that point, we think that the translational bridge is broken. And we need to do some work to fix it. And the main problem that I see is that it is very difficult to publish these negative studies, these negative clinical trials. So the mouse studies may get published in some of the best journals in the world, and they're trumpeted in the media and, you know, on the news. And they really raise expectations for patients. And then we do the clinical trial. And if it leads to a great new discovery, of course, that is also trumpeted. But if unfortunately, which happens too often, it just doesn't work in the clinic, at that point, it's almost impossible to get that work published. Nobody really wants to publish the negative trial. And also, you cannot get on the podium at a big meeting and present a negative trial. Nobody's really interested in it. And the main point we're trying to make is that that's not fair to anybody. It's first of all not fair to the patients and their families who gave, sometimes in the last months of their lives, time to the trial. The information about the trial has to become public. And it's also not fair to researchers, because if the data, the negative data is not known, there's a danger that people will just repeat the trial. And that's bad for the scientific establishments, also really bad for patients. So we think that it's really important when we move from mouse studies to clinical trials that negative data get published, and that they get published prominently, especially if the mouse studies got a lot of attention. And I'll just finish by saying that one of the suggestions has been, and I think it's a great suggestion, that whichever journal published the original preclinical data should feel an obligation to publish the follow-up clinical study. If it's positive, great, but if it's negative, it's just as important, maybe even more important, for that same journal to accept the follow-up clinical study and give it the same attention as the original preclinical and mouse study.
Thank you so much. This was a great insight for me. And I really believe that it's so important to publish those kind of negative reports. I want to hear from you if you believe that us as scientific society could anyway help to facilitate or stimulate this kind of publication also, not only by the journals, and I think this is a great idea, but also us as scientists.
Yeah, so I think this is a really good suggestion. I think the scientific societies play a major role, and they play a role in two ways. Almost all the scientific societies, whether you ASCO or ESMO or ACR or ACS and so forth, have very well-respected journals that they publish. And so they could make a policy that they do follow-up on their preclinical studies by publishing the clinical studies. So that's one way the societies could really participate in moving this forward. And then the other way is most of these societies also have very prominent meetings. Whether you're talking about ESMO or ASCO or ACR, and I could go on and on. And again, I think they could use those meetings to help publicize the data, not just from positive clinical trials, but the negative clinical trials, especially when they're built on preclinical data that has really gotten a lot of attention. This is the only way for us to learn to move forward. And a negative clinical trial doesn't mean that you're never going to work in that area again. I can tell you, just as an example, immunotherapy for a long period of time didn't work. People just thought it was not going to be a successful field. So just because you have a negative study doesn't mean that you give up on a field, but you have to know about that negative study in order to improve your techniques and improve your methods in order to move forward. And I do think the societies, as you mentioned, should play a big role there.
Okay, perfect. Thank you so much for this explanation. And I agree with you. This is so important because we don't want to make the same mistakes, right?
Absolutely.
Yeah. And thank you so much for being here, Dr. Kurzrock. It was a pleasure to be with you, to hear from you as an expert in this area. And thank you, everybody, for watching this interview.
Okay, thank you.